If you've been watching my channel for any length of time, you already know I've done a lot of videos about creatine. I am a proponent of this supplement, not because it's trendy or flashy, but because it's been highly studied and it actually helps people preserve strength, muscle, and function as they get older. And those things matter more after 50 and not less. But as the channel has grown, the questions that I get have changed as well. People aren't just asking, is creatine safe anymore? They're asking, is creatine safe for me? And that's really an appropriate question for all of us to ask in regard to creatine or any supplement for that matter, because not every supplement is right for every person. So today I want to dive into this. I'm going to base this discussion on a large 2025 review published in Frontiers in Nutrition, which looked at over 30 years of creatine safety research. I'll put the link in the description below if you want to read it yourself, but let's start with the big picture because the context matters. So here's what we know. For most healthy adults, creatine monohydrate, which is the form of creatine which has been studied the most, has been shown to be very safe when used at reasonable doses. So what does research currently consider reasonable? Well, 3 to 5 grams of creatine per day. That's not my opinion. That's what decades of human research shows so far. But medicine is never one size fits all. There are a handful of concerns that keep coming up over and over again. So let's talk about these because these are the places where confusion and anxiety tend to live. One of the oldest rumors about creatine is that it might cause cancer. Now, this has been floating around for many years, and like a lot of medical myths, it started with a theory that got pulled way out of context. The original concern really didn't have anything to do with actual creatine supplementation. It came from studies looking at what happens when meat is cooked at high temperatures. When meat is grilled, charred, or burned, creatine in the meat can combine with sugars and amino acids to form compounds that in very large amounts have been linked to cancer in animal studies. But here's the point that almost always gets missed. That process happens during high heat cooking. It doesn't happen when you scoop creatine powder into water or juice and drink it. When researchers actually study real people who take creatine supplements, they don't see an increase in cancer risk, and that's important to note. In fact, large population studies show something that surprises a lot of people. Individuals who consume more creatine in their diet tend to have the same or even lower cancer rates compared to those who consume less. Even more interesting, when creatine is studied in lab and animal cancer models, it often shows neutral or even protective effects. In some settings, creatine appears to support immune cells that help the body fight cancer. So when you step back and look at the full body of evidence, there's no good human data showing that creatine actually causes cancer, none. But that fear persists mainly because the high heat cooking story scares people, especially when it's explained out of context. But what about specific cancers? Many of my subscribers are men, and like many of you, I've read concerns suggesting that creatine can stimulate tumor growth, particularly in prostate cancer. This concern comes from lab and animal studies showing that some cancer cells use creatine and phosphocreatine as part of their energy system. Researchers have observed higher expression of creatine transporters and creatine kinase in certain tumors, including prostate cancer. Now, that understandably raises eyebrows and concern, but here's the critical distinction. Lab studies and mouse models don't equal human outcomes. In humans, there's no clinical evidence showing that creatine supplementation worsens prostate cancer progression, increases PSA, or accelerates tumor growth, or increases reoccurrence risk. None. What we do have is observational data showing no increase in cancer incidence among creatine users, and in some cases even lower cancer risk among those with higher dietary creatine intake. We also have evidence that creatine may help preserve muscle mass, support immune function, and reduce inflammation during cancer treatment. And that matters because muscle loss during traditional cancer therapy is a real and serious problem. That being said, prostate cancer isn't just one disease. It exists on a spectrum from very low risk disease to very aggressive forms. This isn't a one-size-fits-all situation. For someone with active metastatic or higher risk prostate cancer, this also isn't the time for casual supplementation. In fact, that's a scenario which should prompt thoughtful discussion with an oncology team. Creatine hasn't been shown to be harmful in this setting, but it also hasn't been shown in any form or fashion to cure cancer. So the decision becomes individualized, not dogmatic. For men on active surveillance for prostate cancer or those who are post-treatment and focused on recovery, for muscle preservation and long-term health, health, creatine may still have a role, but it still deserves a conversation with your doctor and not just a reflexive yes or no. That's the most honest thing I can say about it. Now let's talk about kidneys, because this is probably the #1 concern that I hear, especially for people over the age of 50. Here's where the confusion starts. Creatine breaks down into creatinine in the body. Creatinine is what the vast majority of doctors in the United States use as a rough estimate of kidney function. So when someone starts taking creatine, their creatinine level may actually rise somewhat. That doesn't automatically mean that the kidneys are damaged. That's not kidney failure, that's math. There's simply more creatine in the system being converted into creatinine, which often just increases the creatinine value on lab work. When kidney function is measured using tests that don't rely on creatinine alone, study after study shows no evidence of kidney damage from creatine in healthy adults. And these aren't short studies. We're talking about trials lasting months to years, sometimes even using doses much higher than what most people take. And what's reassuring is that this holds true even in populations that we all worry about. Older adults, people with type 2 diabetes, people with only one kidney, even people with mild kidney disease. When kidney health is evaluated using better tools like cystatin C, urine protein measurements, or direct GFR testing, creatine does not appear to accelerate kidney damage. That said, this is where nuance matters. If someone already has known kidney disease, reduced kidney function, or abnormal labs to begin with, creatine isn't automatically bad, but it does mean that you shouldn't fly blind. Monitoring needs to be done properly using markers that aren't distorted by creatine intake. Otherwise, you risk mislabeling a normal lab change as kidney failure. And many doctors over the years have erroneously labeled patients as having kidney failure or kidney damage when it actually wasn't true, simply because more accurate tests weren't used to verify a patient's true renal status in the context of creatine supplementation. Another common concern is that creatine causes dehydration and muscle cramp. This is a myth that's been around for decades. The original theory was this: creatine pulls water into the muscle cells, so people naturally assume it must dehydrate the rest of the body. That sounds logical at first glance, but it turns out that it's wrong. What creatine actually does is increase total body water, not just water inside the muscle, but overall water content. When researchers study people taking creatine and exercising in hot environments, they don't see higher rates of dehydration or heat illness or cramping. In fact, several studies show just the opposite. People taking creatine often experience fewer muscle cramps and better temperature regulation during exercise. Even when people start off mildly dehydrated, creatine doesn't seem to worsen the situation. If anything, by increasing intracellular water, it may help stabilize body temperature under stress. So no, creatine does not dry you out. It doesn't dehydrate you when used appropriately. You still need to drink water, of course, but that's true with exercise, whether you take creatine or not. That being said, I've read multiple comments from people who swear up and down that creatine gives them muscle cramps and who have implicated it as a factor in an episode of dehydration. So for those who don't tolerate creatine, whether due to cramping or fear of an adverse effect, sometimes it just makes sense to heed the signals that your body is sending to you. And again, not every supplement is right for every individual. Now let's talk about GI issues, because this one actually does happen to some people. Creatine can cause bloating, diarrhea, stomach discomfort, but it's almost always dose related. When someone takes a very large single dose, 10, 20 grams at once, some of that creatine may sit in the GI tract, pulling water into the intestines and increasing GI motility. That's where problems often come from. The fix is generally simple and boring. Stick to 3 to 5 grams and split the dose over the course of the day to help with GI tolerance. Use reputable third-party tested product. Stay away from products containing multiple additives. The most reliable brands will typically only contain creatine monohydrate and have third-party testing seals on the label. Now, pregnancy. This is the one area where I'm deliberately conservative. Animal studies are actually very promising. Creatine appears to protect developing babies against low oxygen during birth and support brain and muscle development. But here's the hard truth. We don't yet have high quality human trials. Pregnancy changes everything. Kidney function shifts, blood volume expands, hormones change. Nutrient transport to the fetus is critical. Without solid human data, it would be irresponsible to recommend routine creatine supplementation during pregnancy. That doesn't mean that creatine is dangerous. It just means that we don't know enough yet. So unless Unless your obstetrician is encouraging creatine supplementation based on more data, it's not a practice I would otherwise encourage in pregnancy. In fact, this is the one area where it's important that your obstetrician knows all of the medications and supplements that you take. Caution is the overarching game plan in pregnancy, period. So when people ask who should avoid creatine, the answer isn't dramatic. Most people don't need to avoid it, but people with advanced kidney disease, people with uncontrolled medical conditions, pregnant women, and people actively undergoing cancer treatment should slow down, ask questions, and involve their doctors. Creatine is a dietary tool. It's a useful one, but tools are meant to be used thoughtfully. If you're going to use creatine, keep it simple, 3 to 5 grams per day, no loading, stay well hydrated, use high quality third-party tested products. Don't chase extremes. Creatine isn't magic, but it also isn't the villain that some people make it out to be. For many of us over 50, preserving muscle, strength, and independence matters, and creatine may help with that when used wisely. As always, my goal isn't to scare you away from supplements or even to push you toward them. It's to help you make informed decisions based on real data, not internet myths. I'm not your doctor, so check with yours in regard to where supplementation either fits or doesn't fit, given your personal medical situation. If you haven't seen this video about creatine and blood clots, it's worth watching next. Thanks so much for watching. Please share this video with someone you feel would benefit from watching it as well. All the best to you, and I will see you in the next video.